According to the World Health Organization, 90% of people in Africa who need access to depression care do not get it because of the substantial treatment gap that exists. The ratio of psychologists to patients on the continent is 1:1.5 million. Our research indicates that due to the compounding influence of vulnerability, illness, socio-economic hardships, and the past years of the COVID pandemic, up to 70% of Zimbabweans are living with an undiagnosed and untreated common mental disorder, such as depression. Zimbabwe recorded its first COVID-19 case on March 20, 2020. In response, Zimbabwe developed a national preparedness and response plan to minimize mobility and mortality resulting from COVID-19 and associated adverse socio-economic impact. It is against this backdrop that the Freindship Bench, in partnership with OFID and supported by the Ministry of Health and Childcare, sought to strengthen Zimbabwe's COVID-19 response through the provision of mental health and psychosocial support services to healthcare workers directly or indirectly affected by COVID-19 throughout Zimbabwe using the Freindship Bench open line. Our objectives for the COVID Go program were: mental health support to healthcare workers was to facilitate mental health and psychosocial support services for healthcare workers across Zimbabwe. To do this, we conducted sensitization and mobilization sessions at clinics, hospitals, and other healthcare facilities, as well as providing self-care materials and a dedicated call line direct to counseling services offered by the Freindship Bench mental health supporters, with referral options to provincial-based clinical psychologists. Healthcare workers in both private and public health facilities had access to free one-on-one problem-solving therapy sessions, group self-care circles, and mindfulness workbooks which were developed specifically for our healthcare workers and made available in English, Shona, and Ndebele. During the programming period of April to November 2022, we reached over 4,000 healthcare workers from a mix of 84 public and private health facilities in 17 districts across Zimbabwe. We conducted a total of 135 group sensitization and self-care sessions, which were aimed at increasing mental health awareness, to recognize when an individual may be in need of support and equipping the healthcare workers with self-care techniques and skills to use whenever they felt overwhelmed at home or work.
My name is Dr. Rupudzo Mamuka. I'm a psychiatrist, but I work with the Freindship Bench as the Clinical Programs Manager, and I was the Programs Lead for the COVID Go Mental Health Support Program for healthcare workers. Going forward, after having learned so much about the mental health needs of the healthcare workers and their response to the program that we were having, it is very good that we continue with the engagement process with various stakeholders. As we noticed in the programming, healthcare workers came, for example, with challenges related to financial stressors, socio-economic challenges that they are facing, and it was one of the reasons why they sought help from the mental health supporters or the clinical psychologists. So engaging the stakeholders, even at ministry level, to address some of these things, whether in monetary or non-monetary form, for healthcare workers might go a long way in actually addressing the root cause or the root stressors that the healthcare workers are facing, which are outside their work. Healthcare workers also shared challenges to do with the burden of the work that they have, the workload itself, and that might be something that goes towards human resources, working around how many healthcare workers are available at every facility or institution to manage their workload, as this is a potential stressor that can affect their mental health as well. And that continues to be, an engagement process that we also need to do with stakeholders. So sitting down with, ministry level, different directors of facilities or hospitals or clinics can go a long way in coming together now with these recommendations, sharing our findings, sharing the plights of the healthcare workers, and coming up with the best way forward in terms of how to address that.
My name is Pamela Makahamadze. I am a clinical psychologist with Freindship Bench offered Go program for Mashonaland East. I think the major challenge that I faced in the field was the fact that, as healthcare workers, myself included, we are carers. So we are used to caring for other people as healthcare workers. So it's a bit difficult to sort of like take off that career hat and de-roll and become the person who needs the care. So I found it very difficult, to convince healthcare workers that, you do need help, you do need the support. So I think that was one of the biggest challenges that I found with healthcare workers. And the other challenge I found was that, healthcare workers are extremely busy. So they didn't have the opportunity or the chance to take up the service that we had. Constantly, we've got, our hospitals are full. And so they are constantly needed on the job. And, when they finish their shift, they're not thinking of themselves. They're thinking, oh, I need to go home, I need to rest, or, they've got the other personal duties that they need to take care of. And the other challenge that I found was, again, issues of connectivity. I was the clinical psychologist for MASH East. So my area, the province that I was looking at the areas that I was looking at were Caledonia, Epworth, Ruwa, Chitumbiza, and they have a lot of connectivity issues. And our service and our program was primarily done over WhatsApp. So, that sort of like maybe defeated the whole purpose, because the people that I was trying to get in touch with or reach out to could not connect with me because of connectivity issues. One of the healthcare workers was telling me that they actually had to go to a private clinic to go and get tested for HIV, even though where they were working, they could have been tested for HIV. But they felt that, once my colleagues know that I have HIV, I'll be discriminated against. People will look at me differently, I'll be treated differently. So yes, definitely, stigma is a big thing. And especially, with mental health. To say someone is depressed, someone is not coping, they found that very difficult to let their colleagues know that, look, I'm going through a difficult time. So yes, the issue of stigma was very big as well.
My name is Anslin Tnashish Monyo. I'm a general nurse as well as a mental health nurse here at Perinatal Group of Hospital. I'm a nurse in charge in the male admitting ward, and also currently I'm the acting matron since my matron is on leave. COVID-19 was affecting everyone, including us, the healthcare workers. So as the disease was progressing into the country, I was now becoming anxious, and also it was stressful when now the public was a little bit shunning to interact with us as healthcare workers. So at the end of the day, it was now stressful to us.
I remember at one facility, one healthcare worker actually told me about how when she finished work, her husband would actually come and pick her up, but he had this pesticide can, and he would spray her top to bottom before she even got into the car. And when she got home, she had to remove all her clothes before she even got into the house, take a bath. So I think that also contributed to the stress that they were going through. And I remember at another facility, another healthcare worker told me that, to catch like a combi on the road, wearing your uniform as a nurse was very difficult. They would not stop for you because they would look at you and regard you as somebody who's carrying COVID because you are working with COVID, with patients who've got COVID. And again, I think this exacerbated the mental stress that the healthcare workers are going through
we lost some of our colleagues because of this disease. So each time you think about it, you also think about your colleagues that you have lost during that period. And it was not a pleasant atmosphere to work during that period in a health setup, because somehow you might think that your colleague might be having the condition, or if anyone present with a flu-like symptom, you just assume that it's not flu, but it's COVID straight away. And some of the times I still remember whereby you be at home, but unfortunately you just receive a message that the patient that you were nursing during the day is tested COVID. And you just think that, okay, if the patient that I spend the whole day with nursing is now COVID positive, what about me? What about the family that I saw, my family that I've interacted with after nursing that patient? So it was not a pleasant moment at all.
I think the main problem that we are facing as healthcare workers, I might have a problem, but if I want to communicate with you, I might need some airtime or some bundles for me to be able to communicate with you. So I think it's a challenge to some of us. By the time you have the problems, sometimes you're broke, you don't have money. So I think it will help us if we have a toll-free number where we can just call for free, then we talk about our problems. I think that will help us. And I think if we can have yourself having an office here, so that us as healthcare workers, we can just go to your office and tell you our problems. It will also help in the near future. And then the issue of sensitization, I think we need to broaden up the area of sensitization. I think at the main hospital there are most of the people who work here at Parinyatwa, that's where they work. So I don't think they've really, they know about the program as we know it here at Annex. So I think sensitization is another area where you need to improve.
During sessions, using the Shona Symptom Questionnaire, we also provided screening for probable depression and anxiety. It was surprising to note that 27% of healthcare workers screened were at a high risk of depression, and 213, or 6% of them, had thoughts of dying or suicidal ideation. Over 200 healthcare workers were referred to the clinical psychologist to address high levels of depression or suicidal ideation. We are happy that those who received problem-solving therapy from the Freindship Bench mental health supporters or clinical psychologist showed about an 80% reduction in symptoms of depression on follow-up.
The bench motivated me. It motivated me quite a lot. I now know how to take care of myself before I take care of someone else. Yes. It encouraged me to make sure I feed myself well, I sleep well, I have to exercise, I always have to keep a smile to make my working environment good.
Anotibatsira as healthcare workers kuti tikwanise kushanda mumabasa edu. Mumabasa edu tinosangana takasiyana siyana as my mothers, as my sisters, as friends. Tine ma issues edu anenga achitikanganisawo kubva kuma homes atava oro mukushandidzana nevamwe kwatiri tichiita. So these programs anouya achiita as kwekuturira ma-problems atinenge tasangana nawo. So ukataura zviri kunetsa either kumba or kubasa, at least unokwanisa ku-offloada a burden here inenge ichimaunta mauri, ichimaunta yatisingade kuti imaunte mauri, nokuti ikaramba ichimaunta inoresulta into mental illness. Saka this program ikauya ukataura ukainteracta unokwanisa kushanda zvakanaka uchiona kuti maproblems aya alright unodhila nawo so beat auri kusangana nawo kubasa auri kusangana nawo kumba woita basa rako uchinyatsonzwa kuti aiwa apa ndaenda kubasa ndinofanira kuita zvebasa maissues ari kundistressa adhiliwa nawo wamaisa pasaidi yokwanisa kupefoma basa rako at fullest usingaite mamistakes nemaerrors. Saka these programs ndinoona achinyatsoshanda zvakanaka kuma-healthcare providers kutiwo munhuwo anokwanisa kusafa nemental illness akashanda ane zvinhu zviri kumunetsa anoproducer a bad result cause ane zvimwe zvinhu zviri kumuganhurira kuita basa rake nemazvo.
As healthcare workers, you'll be able to identify the problems of other co-workers, and even as an individual, I can do self-introspection to identify my strengths and my weaknesses. I can also be able to identify if the other co-workers have problems such as having suicidal thoughts, or maybe they are depressed. And as you can see, we mix and mingle with people with different personality. So I think it helps a lot.
Us as mental health workers, we are just looked upon as people we are supposed to offer help to our patients only. But people do not view us as also people who can have mental health issues. So I think it helps a lot because we have a platform whereby we can air out our problems, so that at the end of the day we'll be able to take care of the patients without having mental health issues ourselves.
I feel that these programs are very important to us as healthcare workers because generally people assume that the moment you are now working, you know it all. You know everything, and you should just do your work as the carer for the patients. But not knowing that we as healthcare workers, we also have our problems. We are also affected. Mentally, I can also become a patient any day at any time. So these programs, they came to us at the right time, whereby we want those people, we were in a need of carer for us, those that we call carer of the carers, those whom I can say, okay, I've been taking care of other patients, but now I also need someone who can listen to me, who can also take care of me as a healthcare worker. So I'm positively happy with the way this program was introduced to us. So I think that these programs are very much important to us as healthcare workers. We need them as you do your work. You see that anyone is affected by different issues. So there's need for someone to listen to you as you have your problems.
So I think one of the major lesson learned is that I think healthcare facility heads need to provide a safe space for healthcare workers where they can share what they are going through without fear of being victimized, without fear of stigma and discrimination. A face-to-face approach would also be very beneficial to them. They like seeing the person that they're talking to. And I had quite a few healthcare workers saying to me, Pam, online doesn't really work for me. Can I come through and see you? And for those healthcare workers, I would actually make that service available to them. So I had quite a few face-to-face sessions as well. And the healthcare workers also mentioned that, look, you can actually come to our facility and we can have a face-to-face session with you at our facility. And I think, that would be something great that we could do possibly in the future.
Going forward as well, in terms of the program itself, I think from the lessons we noticed that there's still a lot of stigma around mental health, even within the healthcare workers themselves. And that is something that still needs to be addressed, or demystify some of those myths and stigma and issues around fear of being judged by colleagues if someone sought help. So continuing with our mental health awareness campaigns becomes of paramount importance. That obviously still means that we need to source more funds for that. And so we need to go back to our funders and really show that this was a program that was beneficial to the healthcare workers and it is needed to be continued. And another way to actually address this fear and stigma would be to integrate, ensure that mental health services for healthcare workers are actually integrated within other services. We found that with other programs, healthcare workers find it easier to go, for example, to their staff clinic, where they routinely get a check for hypertension or diabetes. If that were incorporated into, their everyday health checkups, it might become more acceptable. And just knowing that, when an organization reaches out to them, it is not just for research or for learning purposes, but it's actually a service that is available for them. So consistency on our part and actually continuing with the service becomes important. And we are so lucky that as the Freindship Bench, as we entered into this program, we did not just start it solely for the healthcare workers, but we already had an existing hotline or open line, which means even if we do not have funds specific for the healthcare workers, we still have a place for the healthcare workers to reach out to us. And given the relationship that we have with the Ministry of Health and other facilities, we have created a referral channel, which we hope to strengthen going forward.
You cannot bring happiness in my life when you're not feeling well. You cannot bring a smile on my face when you're not smiling too. So the first thing that I always tell them is to put a smile on your face first, so that I can also smile at you back. So my colleagues, I always tell them that don't look at the remunerations per se, but this job is a calling. Only God can reward us. And you have to assist these clients as if you are assisting your blood brother or your blood sister. That's what I always tell them every day.
This program has been a proud partnership between OFID and Freindship Bench, supported by the Ministry of Health and Childcare through funding from PEPFAR and USAID.